get started about talking about hair and hair loss, I'm going to tell you a little bit about myself. My name is Carissa Fioritto. I'm a naturopathic physician. I practice in Manchester, Connecticut at Collaborative Natural Health Partners. I also have a nursing degree as well. So I always like to put that plug in. I became a nurse and then I became a naturopath. So a little background about naturopaths in case you are not familiar with them is that we are considered physicians in the state of Connecticut. We do take insurance. We get to diagnose and treat you. The only thing that we are limited on in the state of Connecticut is prescriptive rights. So with that, I'm going to go forward. So when we talk about hair loss, a lot of people will come to me and they'll say, like, I think I'm losing my hair. Hair loss looks very different for everyone. If you tell me you're losing your hair, I believe you. It's really hard as a clinician because people come into me and I'm like, well, you look like you have a lot of hair. And they'll be like, I had a lot of hair before. You can lose 100 hairs every single day. That is just the baseline. And the hard part is that that's like with showering. And so with showering, we're really like getting that scalp and really pulling hair out. And women who wear their hair up in a ponytail too, like they may not see that 100 hairs every single day. And so when they go to shower every like 2 to 3 days, if they're wearing their pony up, it'll be a huge ball of hair. And with that, you kind of monitor it of like, what was my hair like 5 years ago? Like how big of ball of a hair are you looking at versus today? The other thing is that you don't really see your hair loss until you've lost about 50% of the density. And that's really tough because in that time from, 0 hair loss to 50% of hair loss, we could be doing something so that it's not so noticeable for you. The big key things that you will find when you do have hair loss is it's going to be in random places. It's not going to be in your bathroom. I mean, it's going to be in your bathroom. That's a natural place that we're going to find it with regular shedding. But if you're finding it while you're cooking in your food, if you're seeing a lot on your pillowcase in the morning, more than just 1 or 2, and if people are complaining about finding your hair, these are key indications that you are losing hair a little bit more rapidly. So there's lots of types of hair loss. And one of the most critical things we have to do before we start just throwing things at you for your hair loss is figure out what it is that's going on. So the 2 that I'm going to focus mostly on because they're the most common are something called telogen effluvium and then androgenetic alopecia. This is also called genetic alopecia, female pattern hair loss or male pattern hair loss. So either one of those. There's an autoimmune condition called alopecia areata. You're going to see spots with those ones. Tinea capitis is just the medical way of saying having fungal dandruff yeast on your scalp. Anagen effluvium, we'll go over that as well, but that's due to usually chemotherapies. And then there's scarring hair loss that is also autoimmune, like the alopecia areata, except the follicles are completely damaged and you can't have hair growth again. Oops, now I got to go back. Sorry, I got to figure out how to go back on my thing. Sorry, guys, give me 1 second here. Go back. So this is a really pretty picture showing you the phases of hair. And it is important to understand this because then you'll understand the telogen effluvium, the anagen effluvium. So anagen phase is 3 to 6 years. This is when your hair is actively growing. When you think about children getting hair in those first few years, you really never see their hair falling out. And that's because for 3 to 6 years, their hair is just in massive growth. And then there's the catagen phase. This is a very short phase, 1 to 2 weeks, where the hair gets loosened and it's about to fall out, but it's just like in this waiting time. And then the telogen phase is active hair loss. So that it's critical you understand it happens 2 to 4 months, and it takes 2 to 4 months to go into that phase. All right. Not again. Give me 1 second here. I'm a little impatient. So telogen effluvium. This is the hair loss that you see when women have babies. So they have their baby, they're about 2 to 4 months postpartum, and then their hair loss starts falling out. And that's where that telogen comes into play. Stress is the #1 cause of telogen effluvium, and all the things listed below there are stressors on the body. Stress is not just your work, your relationships, your life happening to you. It can also be internal things. And so if you are having hair loss, the first thing we need to do is figure out, is it this, is it that? And we look at iron deficiency. So if you're having hair loss, we need to check your iron. The people who are most at risk for iron deficiency are females who have a menstrual cycle. Thyroid abnormalities are another cause of telogen effluvium. And so a lot of people will go to their hairdresser and say, my hair's thinning out, and they'll say, did you get your thyroid checked? They're really on top of that. And so it is one part that we have to look at here too. A sudden shift in hormones. So your thyroid is hormones. So that makes sense. But also when women go through menopause, one of the top complaints is that they lose their hair. Obviously, having a baby, your hormones shift. They were really high and then they're really low. A sudden shift in your weight. This is very, very common. It's a stress on the body too. It's a good stress usually, especially if you're overweight, you need to lose a little bit of weight. But a lot of times people will, lose 15 to 20 pounds in the first 2 months of doing a very restrictive diet. 2 months in, they'll be like, my hair's starting to fall out. And, we always want to go well, what's been happening the last week or two? And really, it's February. If your hair's falling out right now and it just started, we need to look back at December. What was happening in December? And so going along with this, the stress on the body. So people who have autoimmune conditions, if their autoimmune conditions are flaring up, we see this a lot with COVID. So when people have COVID, it's a virus. It can be really stressful on the body. If you were hospitalized, really sick, you can lose your hair from this. In general, we go with more the iron deficiency, but going along with stress on the body can be just general nutrient deficiencies. Androgenetic alopecia, female pattern hair loss, male pattern hair loss, depending on who I'm talking to. This is probably what I see most frequently with patients. And here's the key thing is that it is genetic. So looking at your family tree, does your mom have hair loss? Do your aunts have hair loss? Do your sister have hair loss? Grandma? It is a question that I ask people. It's a chronic condition, and usually it's slow onset. Some will have symptoms starting in their 20s, and you'll see hair loss right here in the temples. So it's like that male pattern hair loss too. So men see it, their hairline starts receding, but then also the central hair loss right here. And so it's thinning out here. Sometimes women will just see that their part is getting wider in this area, and they won't see as much hair loss the way that men do, but it's essentially the same. Here's a shocker, is that up to 50% of people have this condition. The best way to know what you're dealing with is to see a dermatologist. A lot of dermatologists in the area will do a biopsy, and the biopsy will confirm it based on how the follicles are. And so what happens with these follicles is they are more sensitive to androgens. And androgens are just testosterone and estrogen, but in this situation, we're really talking about testosterone. And so testosterone Women have it, men have it. And there's nothing inherently bad about testosterone, but it breaks down two ways. There's the alpha pathway and there's a beta pathway. The beta's totally fine, we excrete it. The alpha pathway makes something called DHT, or dihydrotestosterone. And your follicles can be more sensitive to dihydrotestosterone. And we can check you, blood work wise. So I will run testosterone levels on especially females, and their levels will be relatively normal, but that doesn't mean that their cells aren't sensitive to it. So I kind of use testosterone to guide as a treatment of like, okay, maybe this is an area we need to focus on. But even if it's normal, we can still look at ways to reduce down testosterone in the body. Alopecia areata, this is an autoimmune condition, and I'll see people with this and they will have just like circular loss of hair, and it will be very sudden, very demarcated, but it can be overall hair loss too. This will also affect other hair on the body, so it'll affect eyebrows, eyelashes, depending on what we're dealing with. The best treatment option for this when it strikes is steroids, and just managing the stress on the body with that. So the scarring alopecia, like I said, it is damaging the follicles and they literally cannot grow back. This is a very unfortunate situation to see. So once you lose that hair, it's not going to grow back no matter what we're doing there. And this is why it's important to have a dermatologist on board, because they take a biopsy of the area that is losing hair and we can see, are those follicles scarred over or are they still okay? Anagen effluvium. So if you go back to that graph and you see, there's the 3 to 6 years that your hair's growing, and then there's the catagen and the telogen. Chemotherapies will affect the hair follicles as they're growing. And this is why people will have all over hair loss when they're getting chemotherapies. We just have to get through chemo, and then we focus on the hair regrowth in these situations. I think one of them skipped just talking about the fungal, but I think I mentioned it with the tinea capitis, is that, we're going to be looking at your scalp. We will see the, what am I thinking of? Scales. We'll see like scales, we'll see like yellowish of your scalp. And we can kind of guess that we're dealing with fungus. You can do a swab and it will confirm. Most people will know, they'll say my head is itchy and I want to itch it. They use things like Head and Shoulders. Dermatologists will prescribe ketoconazole, which is an antifungal shampoo that you can use. And so a lot of times, when we're dealing with hair loss, we might be dealing with multiple types. So I see people all the time who have androgenetic hair loss, but they also have telogen effluvium. And you don't realize you have the androgenetic hair loss until you go through telogen effluvium. So prime example of this is women will have a baby. They have a baby late 20s, we'll say, and they lose all that hair. But then their hair grows back and then they start seeing the hair loss that's still persisting right here, maybe a little bit right here. And now we're seeing that, they're 18 months postpartum. Now we're seeing that there's actually 2 different types going on. And going along with treatments and knowing what type of hair loss you have, like I said, we do have to look at screening with your doctor. So looking to see if you're anemic, if you have low iron, if you have low thyroid, these are all important to do. Additionally, depending on other symptoms, so if you're having things like joint pain, excessive fatigue, psoriasis, eczema, or any of those kinds of things, we're probably going to want to do some autoimmune markers on you as well to see, but seeing a dermatologist as well on your team I know a lot of times people don't want to do the medications, prescriptions when they're coming to see a naturopath, but at the very least, they are excellent diagnosticians. We're going to figure it out, and it makes it easier to understand what are your options and not just like listening to your hairdresser who might just be like, oh, just take this. And you might actually find like it's not doing anything. So topicals, we should take a multi-pronged approach anytime you're dealing with hair loss. A lot of people come to me and they say, well, it's hair loss. I know this is kind of a vanity thing, but it's not. It actually tells us a lot about your body and what's going on. So I don't think anyone is vain for seeking out treatment for their hair. It's a confidence booster too. If you don't have your hair, if you don't feel confident, it affects your whole health. So minoxidil or Rogaine is probably one of the best studied things out there. And you can get these, depending on your provider, sometimes they compound these, so they're a little bit easier to put on your scalp. But this is over the counter too. They have a couple of different percentages out there. And I think the men's is a little bit stronger. But for women, they have the 2.5 and 5%. And really the difference is, do you want to apply it twice a day or do you want to apply it once a day? Minoxidil, the history on it is that they made a pill for blood pressure, and it didn't really work well for blood pressure, but they noticed that people's hair was growing back. So they made it into a topical solution. They do have it as an oral solution as well that you can take, depending on your provider, if they would prescribe that for you. The biggest complaints with this is that it's long-term use, kind of greasy to put in your hair, and it can be hard to get onto the scalp because, someone who's got longer hair trying to apply it might be a little harder to like get it in where you need, especially if you're applying it twice a day. And understand realistically that when you start something like Rogaine, it can take up to 8 months to see the results. And again, you go back to that telogen phase. That telogen phase is 2 to 4 months. And if we're looking at your hair loss and catching you when you have 50% of your follicles already losing hair, to get that to, to a good spot where you can really notice it, that's why it can take so long. And that can be really frustrating to use something every day for 8 months and then be like, all right, is it worth it or is it not? Melatonin has some research as being beneficial for your hair. So the mechanism that I can kind of surmise, so melatonin is a hormone. We all naturally make melatonin. We make it every single night, but they studied it a lot with people who have reproductive conditions like PCOS. And so that's where women will struggle with having regular menstrual cycles. And so it also has some metabolic conditions associated with it. But a lot of times women who have PCOS also have elevated testosterone levels, preventing them from having a menstrual cycle. And, so a lot of times I see women who have androgenetic hair loss also have a history of PCOS too. They kind of overlap. So melatonin can be great. It's really hard to find it topically. I have yet to find it topically, at least here in the States. So caffeine also has some really great studies out on it. The most recent studies that I've seen compared using caffeine with people who use minoxidil, and it was equivalent, which is kind of cool. They do make caffeine shampoos. The hard thing is that caffeine shampoos never put a percentage, and having a percentage on there might be a little bit more effective because like the studies will have a certain percentage on it. Again, I have yet to find it, but usually if you look for volumizing shampoos, you can look for caffeine shampoos. I have seen them on Amazon before. That's going to be the best way for you to find one of those products. The antifungal treatments I mentioned can be beneficial. Like I said, you can get over-the-counter Head and Shoulders. Sometimes your dermatologist will prescribe you something like ketoconazole if you need to, but that can be great in addition to everything else, especially if you have an itchy scalp, you have a lot of dandruff going on too. Rosemary essential oil. So rosemary in the body increases blood flow. We have really good evidence for this. And so if you're putting rosemary on your scalp, you are stimulating your scalp. You're getting that up there. Additionally, like a lot of people who have hair loss are like, I don't want to touch my hair. I don't want to wash it a lot because I want to have more hair loss. If you're gentle with it, it's fine. And even just stimulating this area, so like rubbing it, is actually going to bring some good blood flow. And your hair needs a lot of nutrition to grow. And so blood carries nutrition, and that's why we want it up there. Like I mentioned, steroids for alopecia areata. So we can work on building you up just as a person in between your flare-ups. But a lot of times people who have alopecia areata, if they're under a lot of stress, something is happening in their life, they'll be like, yep, my hair is falling out. They get the steroids and it calms it down really rapidly. And that is a personal choice too. Some people have shorter hair, so like men may opt to not do those things because they're like, I can just shave my head, it's fine. But a woman who has really long hair, it's like it's a long process to grow out your hair too. So it's always a discussion that we can have too. So oral supplementation, and this is kind of where, as a naturopath, I focus on some of the topical stuff, like the caffeine shampoos, the Rogaine. I do tell people that we should do it. If we're dealing with telogen effluvium, iron can be amazing, but we do need to test your level. Iron can be toxic at too high of doses. And then I would argue that toxicity, if you have too much iron, stress on your body, can cause more issues. It can really damage your liver if you just take iron willy-nilly and don't test your levels. Zinc is great for our skin, for hair. So it can be great to add in as well. And when we're talking about people who have the androgenetic hair loss, zinc can be really awesome too, because it helps us push testosterone pathways. And so basically, like, you have your testosterone, we can process it out quicker. If you think about it in an assembly line, we're packaging up the product and shipping them out quicker. Vitamin D, low vitamin D. I mean, who is not deficient in vitamin D? We're in Connecticut. But vitamin D deficiency has been linked with hair loss. So make sure you're asking at your physical or at your next doctor's appointment to know your vitamin D level. It's not just enough to be like, oh, I'm going to take some, because I've had some people come back really critically low. I have some people who are doing okay. And some people just need really high doses. Their body has high nutrition needs and needs a little bit more. So going along with the androgenetic hair loss, saw palmetto can be excellent. And saw palmetto, a lot of people will know this as a prostate formula. And so women will always say to me when they see saw palmetto, like, are you sure you meant this for me? I think it's for men or prostate, or this is what I've read. But again, what saw palmetto does is it helps with that 5-alpha reductase, which takes your testosterone, and that DHT makes it work better. So that same thing, assembly line, let's clear this stuff out. I don't know a whole lot about Chinese medicine, but I do know that Foti root, which is an Chinese herb, has had some good studies on it, and a lot of acupuncturists swear by it. They make formulas that have this in there. When you look at what's in a lot of those formulas, they have like 5 or 6 different herbs, and I couldn't tell you their Eastern meaning and why they choose them versus a Western perspective on it, but I know that it can be excellent. And I guess I should also mention too that I haven't looked at the research on whether or not acupuncture is effective for hair loss, but I would argue that it's pretty low risk. People love it as long as you're not afraid of needles, and they're teeny tiny. And it can be excellent to do in conjunction. A lot of people find it as a stress reliever. So I think that it would be great to add into. So lifestyle, this especially holds true for the telogen effluvium that I was talking about is with dieting. I know you don't want to hear don't diet, but let's go slower with it. Um, Obviously, this is a personal choice. Some people are like, nope, I got to do it hard or I'm not going to do it. And knowing the risk that if I put myself on a really restrictive diet and I do this really quickly, that I might lose my hair. Some people are like, well, worth it. Other people are like, no, thank you. So, knowing that it's telogen effluvium and that once you bring your calories back up and your body's not in such a shock of, basically in starvation mode, that it's okay. Your hair will grow back. But, I don't know if I would want to take that risk. Making sure along with calories that you're eating adequate protein. Protein is the building block of all your cells, including your hair. So hair, skin, and nails, all made of protein. You got to eat enough protein. Tight ponytails will cause issues as well. So, I'm thinking about people who are like in dance and gymnastics, the really tight slip back, you get a headache at the end of the day. That can cause hair loss too over time. I was even reading that sometimes like wearing a sleep mask, you can cause hair breakage. It's not hair loss, but it's hair breakage. But it's just being really mindful of all the things that you're doing up here, and how that affects your hair in the long run. I mean, like using products and things like that too can also have an effect, but I feel like as the entire like shampoos, conditioners, hair products out there a lot better than they were back in the day too. Lastly, stress management. So, thinking about stress, your hair, skin, and nails are usually the first things that go when you are stressed. They are not vital and they're not a priority when your body is under stress. And anytime you're under a lot of stress, your body perceives that a bear is chasing you. It cannot decipher work stress from actually like my physical body is in danger from a bear, car accident, anything like that. So when that happens, all that like protein, all that nutrition that is going in is starting to go to your heart, your lungs, your muscles, your brain, because you need to run from this bear kind of indefinitely, because that's how we live as Americans. So it is really important to think about your stress level with all of this. And so how can you, reduce the stressors on your body? So going back to like making sure your nutrition is on point, make sure you're eating adequate calories, make sure you're sleeping enough. All of these will have a long-term effect positively for your health as a whole. So medications. There are, quite a few medications out there. Finasteride is one of them. A lot of times this is kind of given more towards men, but it can be given to females as well. And so there's other ones in the same class. This is usually given to women who have androgenetic alopecia. So the female or male pattern hair loss, this is really where it's going to be at. And it works on that testosterone pathway I talked about, similar to the saw palmetto. Research is showing that it works a little bit better than the saw palmetto, but they're pretty comparable when you're looking at them. Spironolactone is another medication that will be used too. And so that will help with that testosterone pathway as well. The minoxidil, like I mentioned, orally can be used, but there is a little problem with it. So I feel like women don't want to use it. When you're using it topically, you're controlling for where the hair is growing in. When you use minoxidil orally, you might start getting hair here, you might get a little bit more here. So we don't really know. And some women are like, no, thank you on that, which I completely understand. But men, a lot of times men are like, well, whatever, that would be okay. Thyroid medication is also another, and this is again important that we test your thyroid. We know if you need thyroid hormone or if you don't. Another sign of like thyroid issues is, so if you're having hair loss, but if you have hair changes, so your hair becomes really dry, really brittle, your skin is becoming really dry, really brittle, it might be more indication to have your thyroid checked. Usually this is checked at your yearly physical, but if you're having symptoms, get it checked. You can also ask for antibodies as well with that, because thyroid antibodies lead to a condition called Hashimoto's, which is an autoimmune condition, and it can also cause hair loss, but your thyroid levels will look normal too. There are some procedures out there that can benefit hair loss. So, when I'm talking to people about where they're at in their care and where do they want to go, it's really like benefits, risks, and, when are you ready to take that jump? So you can do something called platelet-rich plasma, and you get it needled into your scalp. So platelet-rich plasma means that we take out your blood, we spin it down, we take that plasma part, and that plasma is full of all these growth factors. And then we take little needles. And so like if your hair loss is right here, we're just going to needle this area. And that's it. What's nice about this is that it's from yourself. So you're not going to have any ill side effects the way you would with medications or that kind of thing. And it's filled with growth factors, so your body recognizes it. And there are some really good, controlled trials out there looking at PRP needling, and it is showing benefit. So the people who could benefit, the telogen effluvium could. I don't think it's worth it, because if we address the underlying issue, your hair will grow back. It just takes time. This might speed it up a little bit more, but that's about it. Androgenetic alopecia, this is an excellent treatment. And the alopecia areata, those two. And so really where this shows is that it slows down that hair loss. So with that genetic alopecia, we are looking at a chronic long-term condition. So it's going to get worse over time. And all the things that we're doing is to keep your hair on your scalp. And this will help slow it down. So I'll have people say like, all right, I was seeing hair, pretty big chunks of hair. Now I'm not seeing so much. The other thing people will notice is that they get increased thickness of their hair. So in turn, they don't see as much as their scalp because the hair that is growing there is thicker. And you can do this even if you don't have hair loss. So your hair will start growing in thicker and looking more, lustrous. But the downside is that insurance has yet to cover this, and it is a high cost for it. By the way, I do this procedure. With my nursing degree, I am able to draw out your blood and put the injections in your scalp. I will say, honestly, people do notice benefit with it. Specifically, they slow down on their hair loss and the increase in thickness. I did have one woman with alopecia areata who had little patches, and I saw her after just one session, and her hair was just like growing like wildflowers. So it is cool to watch. Low-level light therapy is another, it's not really a procedure, but it's a device, and it's red light therapy. I know it has some good studies out there on it. I don't know as much about light therapy with all the science aspect of it, but I know that you wear this baseball cap, and you can see it on here. This is one of the companies that has it. They're called Laser Cap, and they say, you just wear it daily for 20 minutes. It is a really high upfront cost to get this device. I want to say it's definitely over $1,000. I want to say maybe $1,200. But, the company lists on their site that like it's good for 5 to 7 years. And patients who've used it have really used it for 10 or 20 years. So I'm like, I don't know. I think that's kind of cool. But like red light therapy, there's other companies out there that do it too. It's got good evidence. You don't have to go get a bunch of needles on your scalp, and it will help with hair growth. Finally, something to really consider, depending on where your hair loss is investing in a good wig. Because, truly, if your hair loss is at a point, so like people who have scarring alopecia, that hair is never coming back. And insurance actually will probably cover for them to get a wig. So some of these conditions you might be able to get a wig when people go through chemotherapy. A lot of times they get wigs as well as their hair is growing back too. So it is an option. And so with the androgenetic alopecia, if you're not feeling confident, if your hair is falling out, significantly, I really would consider this as a good option, because then you feel like you can put your best face forward. You can be creative with it too. So like I got this like thin straight hair, and if I ever got a wig, I would probably get like big curly hair just to have something different that you would feel confident and good in. But of course, you don't have to do anything that is, wildly different than you. You can find something that is very similar to you as well. Lastly, I just wanted to bring up things that have little to no evidence that people are always shocked by. I'm not discrediting these things as a whole, because I actually like a lot of these things on here, but biotin is like the number one thing you see in combination products that say anything about hair. This is probably like the number one thing that people who see their hairdresser for, they'll say, oh, just start taking biotin. You just take really high dose biotin. There is zero evidence for it. It will make your nails look wonderful. So if your nails are not doing great as well, go for it. But I would not reach for this with hair loss. Sometimes when you go to get a combination product, so if we go back to the slide on all the supplements that has something like zinc in it, vitamin D, saw palmetto, sometimes they naturally have like the biotin in there. It's not harmful. It's just not very helpful. Collagen as a standalone. So I see collagen products all over the place. I love collagen, but it does nothing for your hair itself. Collagen is a protein though. And so if you go back to the slide on the lifestyle, we're trying to bring your protein levels up. And so if we're trying to get your protein levels up, collagen is an excellent way to do that. But collagen alone is not going to cure hair loss, just protein itself. And so if you think about collagen as helping you meet your nutritional needs and meet your protein goals, it can be great. I have some people though that swear to me like their nails are better, their hair looks better, their skin looks better. I think it's amazing. So, you can go with it. And lastly, bioidentical hormone replacement therapy. So one key area of life that women will notice hair loss is through menopause. And you have this shifting of estrogen, progesterone, you have this extra stress on the body, and you'll also have metabolic shifts. So like you're more likely to get elevated cholesterol levels, you're more likely to have insulin resistance or blood sugar issues. And one thing that unfortunately happens is you lose your hormones and you lose some hair. And so, the 5 to 10 years after menopause, women will experience overall hair loss. And while it's great in theory to use estrogen progesterone replacement to kind of bring those levels up, it doesn't really stand up to actually getting your hair loss back. It can be excellent depending on your situation at reducing down your risk of osteoporosis, cardiovascular issues, when we're talking about women specifically, mitigating the effects of menopause. So I do love BHRT, but I just haven't seen it done anything with hair. There is some evidence that possibly using it topically on your scalp is helpful for hair loss. But it's kind of more preliminary stuff, and maybe we'll have a little bit more information soon. Maybe it's something worth trialing. So, all right. So that's the conclusion of my presentation for everyone. And I guess we'll open it up, and Chantal, you can read me any questions that people may have. I think I'm just gonna go in a message. I did get a message here.
You did get a message?
I
Okay.
did get one message. It said, could hair dyes cause hair loss? I think hair dyes could cause hair loss, especially if you're doing a lot of products on your hair. More so we're seeing hair breakage and hair damage with that. And so the vitamins, minerals, or recommendations alongside with that would be the things that we kind of talked about in here. I would more consider it telogen effluvium. But if we're dealing with hair dye, I would say stop dyeing your hair. I'm sorry about that. Maybe try some other hair dyes. And truly, once you take the stressor away, so once you stop dyeing your hair using whatever product it may be that's aggravating it, the hair should come back. So you don't necessarily have to do any of these things except maybe the lifestyle. Make sure you're eating well, managing stress, and get some volumizing caffeine shampoos to help it as it's growing back in. Other questions?
I'm not seeing anything else coming through.
I'm not either. Shampoos.
Oh.
So shampoo, I see one that says what shampoos are recommended. Shampoos, I would say, are just looking for volumizing shampoos, probably to start with. I don't really have brand recommendations for those. It would just be more so like what goes well with your hair. Some people have like curly, thick hair that might need a different type of shampoo and others, but I would say like in general, when you're experiencing hair loss, the caffeine, and like I said, if you go on Amazon, usually like caffeine shampoo, there's a couple brands that will pop up. They're worth trying. Like I said, you don't know the percentages, but you can go through there.
Okay. I do have one that says I have LPP or lichen plano. Oh, I'm going to mess that up. Plano.
Yeah.
I'm working with a dermatologist, though not receiving platelet-rich plasma. Would you recommend this?
So this is considered an autoimmune type condition. And from what I know of it, I do not believe it is a scarring hair loss. So it could be worth trying out. I've never given anyone the injections with LPP, so I think it would be worth a shot. You could double check with your dermatologist. A lot of dermatologists in this area do also do the PRP. And there's another hair clinic around here too.
Another says, been on thyroid medicine for years with thyroid under control. What to do?
So someone's on thyroid medication and it's controlled, but they're still having hair loss.
Yes.
I would do the other workup of like, how is your iron level? Iron deficiency mimics thyroid deficiency. So hypothyroid and iron deficiency, cold all the time, tired all the time, hair loss. Those are like the big ones that I see. I would make sure that your ferritin level, not just your blood count, is checked with that. But then also consider seeing like a dermatologist or someone who can help decipher what type of hair loss do you have. Is it the telogen effluvium, or is it more the genetic type that we're looking at? Because you could have thyroid causing some hair loss, but you could also have a genetic one and have two types of hair loss, but they corrected your thyroid, so it's not the thyroid anymore.
One person says, when I shampoo, my head burns or stings.
I don't know what you're specifically asking with that, but if your scalp is irritated, either if you're itching it a lot, there might be like open sores or spots on there. But it could also be fungal in nature with that. But I would say check with your doctor. If you have a primary care doctor, go see them and see like what's going on your scalp, because you can have infections on your scalp, or you can have things like eczema or psoriasis on your scalp that can cause, just your typical shampoos to burn.
Is Palmetto topical, oral, or other?
Usually we do it orally.
Can you lose hair after a CAT scan?
Can you repeat that for me?
Can you lose hair after a CT scan?
Ooh, so CT scan causes a little bit of radiation, which is oxidative stress. I wouldn't think so. But I guess it would be like, well, why did you go in for the CT scan? What else is going on in your body? I wouldn't think so, but possibly, because again, it's slight oxidative stress, but it would be similar to going through an airport scanner in terms of like radiation levels.
Does having an autoimmune disease like lupus make you more prone to hair loss?
It can, because if you're prone to one autoimmune condition, you're prone to other autoimmune conditions. And people with autoimmune conditions can have low iron because they're in a chronic inflammatory state. And it's an inflammatory condition, having an autoimmune condition. So more stressor on the body, and you can have those autoimmune flares, stress on the body, you can see hair loss. It's usually telogen effluvium if you don't have the genetic alopecia.
What about Nutrafol for any that state hair growth?
So Nutrafol, if I break it down into individual ingredients, it's got a lot of stuff going on in there. It's a very expensive product. I don't personally recommend it. I look at more individual things and we can do it much cheaper, but I have had people use it, tell me their hair's growing back. So it has a lot of the right ingredients, but I don't know if it's the correct strengths. And they really I don't really like them much because, like I said, they're very expensive. And I'm not about, doing that. We can find cheaper ways around too.
What are your thoughts on ferritin levels? I've heard that if the levels are low, it could be a cause. Is this true?
Yes, I see it time and time again. So basically, if you are a female and you have a menstrual cycle, you should know your ferritin level, because I see so many people with a normal blood count, symptoms of iron deficiency. We check the ferritin level and it's below 30, and 30 is very insufficient, even if the reference range tells you that it's not. The reference range is huge, but your ferritin levels should be at somewhere between 70 and 100 to rule out hair loss as the cause, or rule out iron deficiency as the cause of your hair loss. 70 to 100.
Can prolia or recloth cause thinning of your hair?
What was that one?
Can prolia or recloth cause thinning of hair?
I am not familiar enough with the side effect profile of either of those to know if that's one of their side effects. So if you're taking one of those, I would ask that you just ask your prescriber or look at the insert, and usually it'll list it on there.
Okay. I'm in my late 60s and started losing my hair to LPP 2 years ago. Is it a pipe dream to think that I can grow those areas of hair loss at this age?
Would you get 100% hair growth back? Probably not, unfortunately. I'm so sorry. You might get some back if you might be a candidate for the PRP injections. Sometimes people will notice thickening in those areas. It might help cover the scalp better. But I don't know if you definitely wouldn't get the full growth back. Maybe partial might be a goal.
Okay, should I not receive a perm if I have started having hair loss?
So a perm would damage the hair. I mean, out of abundance of caution, I would say it might make it worse. And if you are okay with getting your perm and knowing that you might lose more hair, be okay. But if you're not okay with that risk, like hold off until you figure out why you started having the hair loss. Someone asked me for recommendations on the wigs or toupees themselves, and I don't know if I have any specific recommendations. I know there's a couple places around here. If you do a Google search for places that offer wigs, they are available around. They are costly to get, but I have a lot of people like them. I think someone has raised their hand. I don't know if they're able to type in the chat box, Karen. I can unmute you here. Does anyone else have any other questions? All right. Let me see, maybe one more. Can you try hair extensions? I mean, I don't see why you can't try hair extensions. I think that would be okay to do. The hair extensions, though, are weaved into your hair, or they're glued on. So they're not going to correct the issue. And usually people are doing that for a little bit more length because you still need it hidden under some of the hair. I would talk to a hairdresser of someone who is experienced in doing hair extensions on in your particular situation, if it would be helpful or not.
Someone asked how much is a good amount of Sawzall?
Saw palmetto.
Oh, palmetto, Sawzall, yeah, okay.
Yeah, usually supplementation is about 200 or 300 milligrams or so. That's a good starting place to be at. And like I said with that one, it lowers down your testosterone levels. And to be totally honest with you, I've never seen a woman go from having like normal testosterone levels to like bottomed out testosterone levels with it. Same with men. I've never seen a man all of a sudden not have any testosterone from it. But it is like just a word of caution that maybe it's something that you follow with your provider.
Okay. And same with zinc.
And zinc, so it also depends because you can do too much zinc for too long. We saw this with COVID when people are doing really high doses. It can be toxic and kind of cause some imbalance. I wouldn't do more than like 15 milligrams to start. So they come in 5, 10, and 15. Starting with something lower like that would be great to start with. And then you can follow up with your provider on titrating it to a better level for you. So a lot of times people who are vegan, vegetarian are lower in zinc in their diet and they can afford to have a little bit more, but sometimes people have less.
If someone's asking about how much of the Foti root.
I don't know enough about the Foti root to tell you. I usually see it in tincture form, and usually it's about 2 to 4 droppers full, which is like a half to a full teaspoon. But that's about as much as I can tell you on it that we do tincture wise.
Can stress alone cause hair loss? if you control it somehow, will it grow back?
Yes, stress can. And going back to that slide where I list out the causes of telogen effluvium, technically, all of those things I listed are a stress on your body. And so if you're talking about stress as being external things like your work, you're in school, you have a family, you're taking care of your parents, all of that stuff, absolutely. Again, it's that idea of you're running from the bear. And so if you're running from the bear, we're not prioritizing hair, skin, and nails. We're prioritizing other things, and that can do it to you.
Would yoga headstands help blood circulation in the scalp?
I mean, headstands would definitely increase blood flow to the area. So there's no study saying one way or the other. I don't think it's something they've studied, but it's going to help blood circulation. So yeah, I think exercise, it's something I didn't mention in here, but I think exercise is amazing for blood circulation. And so you could argue that it's going to help with blood flow and get nutrition up to your scalp. Any other questions? I'm not seeing any more questions come through.
No, I just got a message. Thank you. This was very helpful. So
You're so welcome. Thank you for having me, and I appreciate all of you attending. And I hope that you learned something or two about how to help with your hair loss.
yes, thank you very much for doing this for us this evening.
Absolutely. It was a joy.
All right. Everybody take good care. Thank you for participating.
Yes. Thank you, Chantal.
All right. Have a good night, everyone.
Good night.